owned and operated solely by registered nurses, all with advanced skills and extensive experience in home health care. Call us at 888-422-3578. Our team of caring professionals include registered nurses, licensed professional nurses, registered physical, speech, and occupational therapists, medical social workers, and certified nursing assistants. Visit our website at elitehomehealth.com. All employees are subject to detailed background and reference checks. Their team-oriented approach ensures an optimal outcome for all of our patients. For more information, call us at 888-422-3578.
Good evening, everybody, and welcome to Elite Home Health Care. My name is Jackie Birch, hosting the show, and I'm here with Dr. Maxim Chumak. And before we get started with the show, I just want to thank you for being such a supporter of Elite Home Health Care. You always know to choose the best, and, they choose you. That means you are the best. And so much thanks to give. Thank you so much for your service. Maxim is in the Army. Tell me about yourself. Tell me about your practice.
Well, I'm a physician. I graduated from residency in 2012,
Okay.
and I'm still active with Army Reserve. So I served in the U.S. Army for the last 9 years.
I'm sorry, Maxim, you might have
Yes.
to repeat some of that. This mic is dead.
Oh, okay. All right. I hope it's better. So, I'm Dr. Chumak. My patients simply call me Dr. Max because my first name is Maxim, and that's how we call our company, Maxim Medical Robotic Hair Restoration Clinic. You mentioned about the Army. I joined the Army in 2010 during my residency training in general surgery, and I switched to medicine. But I continue being active with Army Reserve until today. I
That's
just
amazing.
actually came back from my monthly training yesterday.
That is so amazing. And of course, being with the Army, you know structure, you know time management, you know the importance of each person and how to really be efficient in a time manner. So how does that necessarily tie into your practice, and how do you use those principles?
Well, being Army trained, that's actually helps, as you mentioned, with time management, as well as organizational skills, right? Ability to respect people, respect your workers, respect and
It's got an amazing team.
Amazing team.
yes.
That's unbelievable. Unbelievable. So I know today you want to highlight on something that I'm not sure if it's fairly new. I'm going to leave that up to you to tell me. The hair restoration process. Who does this benefit? How did you get into this? How can someone know if they're qualified?
Absolutely, yes. So we created a clinic 3 years ago in order to bring the most advanced cutting-edge technology to Broward County. So it started as a robotic hair restoration clinic.
Robotic hair.
Robotic, that means that most of the most critical steps performed with the robotic precision by the robotic equipment. It is not this. So the robot is not the surgeon, okay? So it's
Not yet, at least. It's only 2020 in a few months.
That is correct, but we still need a surgeon, and it's what we define as robotically assisted surgery.
Okay. So a robot.
Right.
That's a little weird. No?
Well,
People trust it? How do people feel when they come in and they hear that a robot's going to be in the room?
Well, the robot is actually quite a big machine, so it cannot be unnoticed. As soon as patient arrive, and actually most of the patient they seek our services as an alternative to minimally invasive, highly precise procedure that will let them to go back to their daily routine much quicker than any other alternatives.
Much quicker. I mean, we were talking earlier before the show, there's no downtime. There's absolutely no downtime. And being somebody that has 2 jobs and is still in school, I know the importance of getting up and going. And the fact that you can offer something that's so beneficial with no downtime, I'm interested. I am interested in that.
Well, so far you're not a good candidate because I can
Me?
see. Yes. I
just
can
a
see
wig.
you got pretty good hair. So,
Thank you.
but of course, but most of our patients are male and
Males.
with certain degree of hair loss. Of
Okay.
course, women are good candidates too.
Okay.
And 30% of our patients are women, and we be doing fairly good. So yes, the difference is, of course, that if you can go back to your normal activity,
Right.
normal life, on the next day, that's
It's amazing.
that's really
No
valuable.
Stitches, no stitches.
No
at all?
stitches.
No stitches, absolutely.
So then
no
that means
stitches.
that there's no scars.
Yeah, there's no linear scars.
Okay.
Okay, so it's virtually undetectable after the
Wow.
procedure. I always bring an example. One of my colleagues had a procedure, and he is a very prominent doctor, and he was able to go around on his patients in the next half hour after we finished
Half
his
hour?
surgery. Yes.
Oh
He had
my
a little
gosh.
bandage around, but he was working in the hospital and seeing his
knew.
patients. Yes.
That's incredible. That is so incredible. And that just anybody listening that has this issue and that is interested, that just provides so much relief because it is something that people get a little insecure about, which it shouldn't, but it is. And just to know that there's no downtime and that it's unnoticeable, it's amazing. What's the age range? Who do you see mostly?
So most of the time, we're talking about people with more established hair loss, right? There are different categories of hair loss, and it's called the Norwood scale, right? So we typically see people with a little bit more advanced hair loss, like Norwood 2, 3, 4. Women have a little bit different classification.
Okay.
And again, before we decide whether surgery is a good option, we start with very detailed examination, laboratory. If necessary, we order labs. We do a trichoscopy, and to make sure, this person is a good candidate.
That is so amazing. Now, I know that there's no downtime, but how long does it take for one to see results?
It varies.
Okay.
But we're talking about 4 to 5 months to see some initial results.
Okay.
Because what happens once the purpose of the surgery is basically to move more permanent hair from the back of the head to the areas that with depleted or hair loss.
Okay.
And what it takes time, so there is some time for the hair to recover before it starts growing. But we typically see between 4 to 5 months to see about 40 to 50% of the
Okay.
hair growing.
But that's still not that bad, honestly. 4 to 5 months. It's not even a half a year.
Absolutely.
And that goes by so quick.
Great results.
And the
Great
nice thing,
results.
it's a gradual process. So it's not like somebody
natural.
with no hair
Right.
wakes up with a full head of hair.
Right.
Everybody
and
noticed that. So-
Absolutely. And 4 to 5 months, some people may say, ugh, I don't want to wait that long. I know that there's at-home things that I can do to increase my hair growth. But, you want permanent, you want good results, you want someone that you can trust, you want somebody who you can feel safe with going to. And
Absolutely. And this is for anyone who is researching the possibility of hair restoration procedure.
Mm-hmm.
It is important to make sure whether place you choose to go, you investigate as much as possible to make sure it's a right person who does it.
absolutely.
There is a black market right now for hair restoration, and it actually happens in the United States where
Yeah.
people go and they see doctor, and then they see the doctor after the procedure. Okay, for the first and the second time. So it is important to make sure the surgeon that sees you, he is the one who's going to perform the procedure.
Right.
Very important.
Right. Research everything. You make sure that the person is legit and everything.
Absolutely.
With this procedure, are there any risks?
Like any procedure, there are risks, right? There is risk of infection, there is risk of bleeding.
Right.
However, because of such a small footprint that the robot creates during the procedure, the risks are minimal. And so far, we were lucky; we did not have any side effects or any complications.
Absolutely. That's insane. 3
Yes.
years and no side effects.
Right.
That is unbelievable. And yes, 3 years isn't 10 years, but still, it's quality. of years, not over the quantity of
Well,
years.
3 years of robotic hair restoration.
robotic hair
Yes.
restoration.
Prior to that, I was performing a more traditional way with what they call the FUT procedures.
Okay.
With the strip created in the back of the head, and obviously it is more invasive. It's still a good option for some patients, but the recovery period is longer. There's more chances of complications like nerve damage, like bleeding, infection. So definitely, robotic hair restoration, that's the future, and it's happening now.
That's incredible. That is so incredible. We always talk about such technological advances and how they're impacting everyday life and how they're going to be seen in the medical world. And this is a really cool example. And when I know myself, and I know I'm not so great with technology, and I know I would probably feel a little bit skeptical, excuse me, going into a room and seeing robotic hair restoration. I would feel a little uneasy. Do you get a lot of people that come in and feel skeptical?
They are, of course, but what is important to realize, and I want to emphasize, you're not being operated by the robot, right?
Right.
The robot is only a tool in the hands of surgeons. So when we perform the procedure, I'm 100% of the time with the patient, sitting them, and controlling every single move that the robot does. And I correct it in case we need to make some adjustments. So the patient is never alone.
Okay.
We consider, again, just like a scalpel in the hand of a general surgeon, this is the tool that helps me to get better results.
Absolutely. Absolutely. That's amazing. I was reading up a little bit on you, and it does talk about a little bit of some types of procedures, the FUE, FUT, VCV.
Oh,
Am I
okay. All
pronouncing
right.
them correctly?
Well, so there is
Other, right? You have some other-
absolutely. So if we look into briefly into history of hair restoration, it started in sometime in the modern hair restoration was started by Dr. Orenbach in the United States, and there was some research going in Japan. So it started back in 80s
Okay.
with FUT procedures when
Great.
we create a linear scar in the back, and we remove certain amount of tissue, and we divide it into little hair follicles, and we transplant in the front of the head. So this is one big chunk of about 48% right now of surgeries worldwide performed by FUT method. Another one is FUE, or follicular uterine extraction. So,
Okay.
and that's what we do most of
Okay.
the time. And how it stands, we remove one by one follicular units, 2 or 3 hair follicles, and we can do 1,000, 2,000, 3,000
oh
times.
my God.
So it's
And
fast.
Oh
it's
my
fast. So with the
God.
robot, it's fast. And what happens, they're less than 1 millimeter in diameter. So when we finished and everything heals, after 5 days, most of the time we don't see any macroscopic, any obvious evidence of any procedure happened.
Wow.
Just 5 days after.
Wow. Now, when people grow back their hair, it's their real hair?
That is correct.
It's
That's
their real
own
hair. I mean, they can cut it, they can brush it, they can pull it, they can do
Yes.
whatever they got to do. Oh, wow.
Absolutely. It grows just because it is their own hair. What happens usually, we typically lose hair on the top of the head. We retain hair in the back of the head on the sides. So we call it kind of permanent hair. And so we move this permanent hair to the areas that don't have enough hair. Right?
Okay.
The areas of alopecia.
Now, is there something new that you're going to be getting into? We heard little.
Yes.
Right. What is this, the new project you're going into? I mean,
Yes.
it sounds like you're already doing so much. I can't
So
imagine.
at Maxim Medical, we're trying to be on the top of technologically, and we work in. We are a research center for restoration robotics, so we do test new technologies. Of course, one of the first and introduced new ideas. I just came back from Bangkok. I was attending International Society of Hair Restoration Surgery symposium, and there was a new technology. It's called Regenera Activa. It was developed in Spain, and so far up to date, 60,000 patients were successfully treated worldwide. Was FDA cleared in the
Wow.
United States, and we're the first one to actually bring it to United States. So what
Hi,
it's,
Linda.
in
Continue.
yes, in a nutshell, it helps with treatment of androgenetic alopecia by taking healthy hair, creating 40,000 micrografts, and implanting it to the area of the hair loss.
Okay. That is incredible. That is a process that's not done overnight. A little bit of construction on the studio, but that's okay. Anyway, so with all of that, what's to come?
A lot. So eventually, there's going to be a stem cell treatment.
Okay.
There's a lot of works right now. It's not ready yet for the commercial use, but there is a lot of research going, and this is something that, of course, if we're looking into probably 5-10 years future, that's what's going to happen, and it will be probably a solution to a lot of people who cannot, for whatever reason, cannot have a traditional surgery.
Wow.
What
That
about,
is
now, what about the IVs? I know sometimes you dabble in the IVs and the PRP. Can we implement that
Absolutely.
into the hair? Is
Abs-
that a part of the?
Absolutely. So every patient who come to Maxim Medical for any type of hair restoration, it could be a surgical, non-surgical hair restoration, we're trying to address this problem from as many directions as possible, right? So there's no just one perfect solution.
Right.
Okay. The goal is to fight it from any means that we have, and one of these is PRP treatment. Regenera Activa, which is very promising, and I've seen such a good results with a procedure that takes only about an hour, and you can have close to a full head of hair just a few months after.
That's incredible. And even that you said that every procedure is different. I like that because every person's different. So
Right.
it just goes to show you go in, you do the research on that person and you find what's best for them. And everything minimally invasive, everything time efficient. I mean, this is exciting.
Absolutely. So, for example, for somebody who has a different type of problem, for example, a woman comes with hair loss, right? It could be due to a variety of reasons, due to hormonal changes. It could be just simply anemia, right?
Okay.
If we correct, or thyroid disease, so if we correct this problem, we pretty much solve the problem of hair loss. And I've seen
That is
people
so
who
great.
did not know about their thyroid condition, and
I
they
mean, there's
came
so
because
much
of the
not
hair
to
loss.
know. There's so
Right.
much not to know, and everybody thinks that they have all the answers after one thing. But you know, just going to show if you find the right person, what you even said in the beginning of it, to do the research and to take the time to get the best results, it's super important because you don't want to just go anywhere and do anything for you. It's your health.
Absolutely. So
That's incredible.
He's attacking it. It seems like from the inside, working
Right.
out. So
Right,
he's looking
right.
at everything.
yeah, so we do have different options. We have a laser therapy. We have IV cocktails that we can formulate to include certain vitamins or minerals that can help in overall improvement of health. We can use, as I mentioned, PRP treatment. We can use Regenera Activa, certain medication like finasteride, minoxidil, also very helpful.
That is so incredible. The IV treatment, does that go in your vein here?
That is correct.
Right.
So
Okay.
traditional IV
Oh, great.
with
Yes.
lots of good vitamins, right? Doc?
That is correct. We have an IV lounge, a very nice room with very relaxing, that you are in zero gravity chair while we're getting the
What?
IV therapy.
You
And
guys are
with
advanced. I might just come in to just sit down in the chair.
Absolutely.
You have to come
I
in
can
into
share
an
your
IV. Well, I
experience,
do.
yes.
I do it all the time, and that's
Oh,
actually
wow.
and he has one that's a remedy tonic. So if you have the flu, especially now at the flu season, you go in, get a remedy
Really?
tonic, and you feel a lot better with all the vitamins.
That would have been great to know about a month ago for me. But no, that's incredible, especially during the season. Everybody needs something quick because Yeah, it is the flu season, but work doesn't stop.
and it's not
Responsibilities
over
don't
yet.
stop. And it's not over. It is not over. So you do other things other than the hair restoration, yes?
That is correct, yes.
That's incredible. What are some of your highlighted?
As I mentioned, a part of the hair loss could be due to hormonal changes. So I was trained in treating hormonal deficiencies in men and women.
Wow.
We do some aesthetics, of course. Okay, I love doing Botox and procedures, injections, and hydrofacial. Facial PRP, we have incredible results with using sort of a stem cell therapy, like Originator Activa can be used for facial wrinkles
Wow.
and improving overall,
You do it
overall-
all.
Absolutely.
I feel like I'm going to find myself in your office one day. It's not a bad thing. I'm super excited. I'm so glad that now that there's something to make everybody feel comfortable. I feel like comfort is really important to you, just from how you're explaining everything from the zero gravity chairs to the, you're ensuring the patient on the best treatment that they can get.
The procedure rooms are beautiful. Everything, the whole office you walk in, you just feel a peace of zen. I know because I've been working with Dr. Max, and he also does his internal medicine side. So he has it's just such a nice feeling to go in and you're
Right.
relaxed, and you can go into any one of the rooms and you're instantly calm, and he
That
puts you
is
at
so
ease.
amazing.
It's nice
It's
to have
so
someone put you at ease
amazing.
when you're going in, especially for the procedures and the
Oh, yeah.
Yes. Yeah, one of the attestation, you can read our Google reviews,
Right.
and they
Amazing
kind of
reviews.
speak for themselves, because we do pay special attention on just to provide as personalized care as possible.
Personalized and
Yes.
safe and comfortable, because that obviously is a thing. You go in for any type of procedure, no matter how minimally invasive it is or whatever it is. If it's a surgery, like I said, a minimally invasive procedure, you're nervous
Yes.
because there's something wrong. But that is so reassuring to our listeners and to everybody that goes into your office. And with the Google reviews, how can I find them? What's your website?
Oh, it's very easy to remember. It's bringbackhair.com.
Bringbackhair.com by Maxim Health. That is so incredible. How do I reach you? What phone number?
Okay, so easy to remember. It's 833 more hair.
833 more hair.
Yes. 833 more hair or 954-945-2909. You can call us, email. We are very responsive. We typically respond within 20-30 minutes to any email, even on Saturday and Sunday.
That's even. I feel like I'm really praising you on everything, but I know how many times I call anybody, let alone a doctor's office, and I don't hear back for a week. And by the time the week's over, I already found another one or my problem's resolved. So
Right.
it just goes to show time management with him, and you care.
Well, we try to build a long-term relationship with our patients.
That's important too.
Absolutely, and most of the patients, they stay with us for any of their needs that I can address.
Right.
Right. Regarding the procedure itself, I'm trying to make it as comfortable as possible.
Right.
So, patient is, as I mentioned, a zero gravity position. I've tried to arrange so he or she can actually sleep during procedure. It's a local anesthesia, right?
It's amazing. That is so amazing.
I've actually fallen asleep while getting an IV. I've had a hydrofacial and so they've actually done the hydrofacial in the IV room for me to relax me even more.
Oh my
Gotta try the
gosh.
hydrofacial. I go in on Saturdays, and the girls are amazing. Dr. Max takes
Oh, I'm gonna be
full
in
care
there.
of everybody, and it's something that is out of this world. I love the hydrofacial machine, and you always have new stuff coming out. So
There's always something new. So stay tuned on his website and everything. And if you guys are still skeptical, which I don't know why you would be, you know that he's with Elite Home and Health, and Elite Home and Health is the best of the best of the best of the best, meaning that Maxim is the best. Stay tuned, guys. We'll be right back with some more Elite Home and Health professionals.
perfect.
Many patients come into the emergency room ill. but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home Medicare pays 100% of the cost with no co-payments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services. Elite Home Health Services is a CHAP accredited and Medicare certified home health care agency that is owned and operated solely by registered nurses, all with advanced skills and extensive experience in home health care. Call us at 888-422-3578. Our team of caring professionals include registered nurses, licensed professional nurses, registered physical, speech, and occupational therapists, medical social workers, and certified nursing assistants. Visit our website at elitehomehealth.com. All employees are subject to detailed background and reference checks. Their team-oriented approach ensures an optimal outcome for all of our patients. For more information, call us at 888-422-3578.
Over in
New
this
blood.
year. New blood in the first year.
Welcome back to Elite Home Health. I am here with Dr. Kyle Peterson, your traditional primary care doctor. Just wrote down so much as we're talking as the show comes back on. So Dr. Kyle Peterson, tell me a little bit about yourself and your practice.
So I'm opening a brand new primary care office in Hollywood, Davie area there, and it's set to open December 19th.
Coming up soon.
Yeah, that's our grand opening is the 19th, and then we'll start seeing patients Monday through Friday. Got a good group of providers that are going to be there. Myself and Sandra, who is a nurse practitioner. We're going to be opening up for primary care, serving the population that's in the nearby area.
That's incredible. Now, I know that there's so many primary care practices in South Florida and Florida in general. What makes you really stand out?
Well, we're going to emphasize on patient care and some education. I've been working in different urgent cares recently, and I've seen patients in there that, one, can't get in to see their primary because they're too busy. Or
I can even vouch for that. I'm guilty. I go to urgent cares because
yeah, you want the service now, right? So
I do.
we're gonna make sure that we keep hours open during the day for walk-in appointments instead of just scheduling everybody out.
Walk-in appointments at a primary care. That's incredible.
Because that's what people want. They want their primary care doctor.
Right.
They want to be able to follow the same person every time. You're going into urgent care, you don't know who you're going to get.
Right.
You want to see your same person.
Absolutely. Just the comfort of knowing that. And how is that? You think that's going to be difficult? How are you feeling about that?
No.
Well, you say that you've been in the urgent care, so you kind of know how to deal with it, right?
Right. I've been in dealing with patients in hospital settings and urgent care, home health. I've done some stuff with Elite Home Health as well. So
we have Zach
Guilty.
as he says, his partner in crime is Elite Home Health recruiter.
Yeah.
He is
So-
here.
The new blood.
But so I mean, I've just seen a need for more primary care, and patients in general
Absolutely.
just don't have what they used to have. It's more of a in and out, run of the show, 5 minutes with the doctor, if that.
Yeah.
And that's not something we're looking to provide. We want to provide personalized care, focus on some education, help people understand their medical conditions, why they're taking medications.
That's incredible.
Yeah, I was going to say, I know me and Doc were actually talking about this over dinner before, and your stress is heavy on on education, right? What are some examples, or where have you seen that, and how's it lacking in the community? How can you make a difference with that?
Right. So as I've seen patients, they've come and I'm like, what medications are you on? What are your medical problems?
A lot of them don't know,
I don't know.
right?
That's the answer I get. I don't know. Or they give me a list that they've printed off.
Right.
And I'm like, why are you taking this? Like, I don't know.
I don't know. I was just
take
told it.
I just take it.
That's incredible.
And so I think that's where there's going to be some focus and education, focus on wellness, prevention. Even a healthy individual can see their doctor on a primary care side, get preventive medications, not medications, but preventive medicine, lab work, or, hey, let's work on this before we get to having a problem where you're diabetic or
Right.
where you're having, lung diseases or these chronic health conditions that can really debilitize you and
Absolutely.
keep you from functioning.
Not only coming instead of going to the urgent care,
Right.
preventing from having to go to the urgent care.
Providing a comfort almost. That's awesome. So I know myself, I don't know anything about the medical world. Anything.
Most
just like
people don't.
right, just like most people don't. So
Most people don't.
knowing education.
Right.
What are you really going to try to educate more so on? Sicknesses, how to prevent, or medications?
I mean, kind of whatever it is for that patient. I mean,
Okay.
every patient's going to be a little bit different. I mean, I had a patient one time that was taking blood thinners, Coumadin. She understood that she needed to take them so she wouldn't develop like a stroke or something like that, but she didn't really understand why. And then she was like, oh, I want to lose a bit of weight, so I'm going to eat healthy. I'm going to have like spinach, and I'm going to have extra greens and vegetables and salads. But little did she know that doing the things together, the Coumadin with the extra greens, were going to counteract each other
Right.
and put her at more risk for stroke.
Wait, so two different things for your health base effectively cancel them out.
Yeah.
Which you would think, eating healthy, right?
Right.
That's
And that's interesting because that's everybody's go-to, especially with working out. Everyone's like, oh, well, I'll start running 7 miles a day. I'll start eating only broccoli. But it's like you have to become educated in anything that you're doing in your life. But health is so important.
Right.
Because you always see, people that get diagnosed with these diseases, cancers, God forbid, anything. Sometimes there really isn't much to do to prevent, but sometimes there is.
Right,
And a
and-
lot of the times people just don't know.
And not even maybe prevention, but just making sure that things don't get worse.
Right.
Here she thought she was doing a good idea by eating healthy, having salads and
I would have thought that
extra
was a good
greens.
idea.
Yeah.
I'm sitting here, I'm like, oh, he's going to tell us like a really great story to start us off. I was, you know what, I'm going to go pick up a salad after this.
And I mean, obviously, eating healthy is great, but just
Right.
knowing, okay, why am I taking this medication? What do I need to watch out for? What condition am I taking this medication for? If you tell a patient, are you hypertensive? They're like, no, I'm not. My blood pressure's fine. I'm like, well, you take 3 hypertensive medications. Obviously, you're hypertensive. We need to
Oh
make
my
sure we watch on that. We
gosh.
have to make sure that we, are able to understand, like, hey, this is what's
Right.
going on. This is you. This is your health.
Absolutely. And I think I want to touch back on even the losing weight and eating healthier kind of portion. A lot of the medications that people are on fluctuate their weight and they don't know.
Right.
So it's them becoming frustrated, them not eating properly, them losing the nutrients that they need to fight whatever they're fighting. So just to know that there's education in visiting my doctor so that I'm not leaving my doctor and going on my phone and looking things
Right.
up and getting false answers.
Google Doc.
Google will kill me. Google will kill me, and you can
Doc.
save me. So
Google's a lot of information, but you have to be able to apply it. And I think that's where the general public misses a little bit. And if I can help educate even, 1 or 2 patients a week just on how to help
Right.
manage their own stuff, then I think that's a win.
So I'm sorry.
No, you're fine. I just think that's amazing because I've seen a number of doctors over the years, and
Oh, yeah.
I've never heard one talk about. I've never
No.
gone to the doctor and been like, "Yeah, doc, I ate this morning."
No,
and
yeah,
gone
that's
over
true.
it. So to have a doctor that is asking the questions like, "Hey, what's your diet like? Let's actually talk about it."
That's great because, like you said, I mean, I just moved from Long Island about a year and a half ago, and I'm guilty. I think I even told you guys the last time I was on, I'm still looking for a doctor. I'm still looking for somebody to go to when there's something wrong, which is why I result in urgent cares. And it feels really impersonal. It feels rushed. It feels like I genuinely don't know if I should be taking these medications, sometimes resulting in me not even taking the medications because I'm in my own head, I don't need this, and my condition getting worse. So for you to sit there and take the time is so important, and I just want to emphasize that with everybody that's watching. It's so important. I'm like, I still don't have a doctor down here. So with this personal care that you apply, are you going to limit the amount of patients and appointments that you make during a day?
So, like I said, we're going to make sure we have a block of time that's open for people that feel sick that day that can always call us and say, hey, can I come in and see you guys today? Yes, we want to see you. We don't want you to go off and look on Google and see what's
Right.
going on.
It's such a millennium thing to do.
Yeah.
It really is.
It is.
I'm guilty.
and as a society, we want things now. We want things fast, but then
Yep.
you end up sitting and waiting hours, maybe in an urgent care, maybe not an hour or two, but depending on how busy it is, you might be there for a while. But if you know, like, look, I have an appointment, I can go in, see the doctor, get what I need, and I can get out and go about the rest of my life
What do
doing the
you-
right things.
What is your view on wait time? Because I know even way back when I did have a doctor, I would make an appointment for, say, 2 o'clock. I'd be seen at 3:15 or
Yeah.
3:30, and it was the most frustrating thing.
And that's overbooking. That's scheduling patients every 5 minutes, knowing that you can't see everybody every
Right.
5 minutes. So making
Just
sure
going
that,
back to the rushing
yeah,
point
just
of
making
view.
sure that look, if I have a patient that's going to take a little extra time, maybe they have a list of 10 chronic diseases or they're on 15 different medications, they're going to take time. So we'll have
Right.
to make sure that we schedule them extra time to make sure that they get what they need, and that way the other people that are waiting then don't end up waiting.
So you really focus on who you're booking. It's not just you walk in and, okay, Jaden Smith is coming in at 2:00, and then Jackie Birch will be in at 3, and then whoever will be in at 3:15, 3:35, whatever.
Right.
You really,
We want to know who's coming in. We want to make it be a connection, and a primary care is almost kind of like your family. You know,
Yeah.
this is going to have to be like
Right.
your family. This is knowing who is coming in, knowing what they're coming in for. If we can get that information prior to a booking, if it's just a routine, then okay, it's a routine. Coming in, checking on how we're doing. Maybe it's a little bit, hey, what's going on? What's new? Seeing if there's anything there.
Family
Obviously,
medicine
the-
for a reason.
family.
Yeah, family
so it's
medicine.
family medicine.
Yeah, that's my board certification is family medicine, family
Okay.
practice.
So is this going to be able to, are you going to apply the family medicine where you can see children all the way to elderly?
Yeah, so we're going to take all ages. We're not going to cover
Wow.
the vaccinations with
Okay.
the super young, the pediatrician type. That's another specialty all in itself. We'll let them do their thing. But as far as the family cares, the colds, the flus for the kids, the youth, physicals for school sports,
Wow.
injuries, things like that, we'll definitely take care of those. And then obviously as we get into adulthood, things change, focus changes a little bit. It's prevention while you're in your 20s and 30s and 40s.
Right.
And hopefully you can avoid having hypertension, diabetes,
Right.
weight gain,
Right.
all these different things. So, the different age, gender, or the different age gaps
Gaps.
are going to be what the focus is going to change. And that's where the primary care doctor, the family medicine doctor comes in. We're able to focus on the teenagers, the younger ones, the middle age, the young millennials, as we're going to call it, and then obviously the elderly patients as well.
That's so great. That is so great. And just to know, I mean, that you're with Elite Home Health just provides a little bit of comfort. And
Right.
thank you for supporting us, as
Well, I mean,
always.
course.
that's where Elite Health is going to come in. Is people are going to need some care at home. Especially the elderly ones, the ones that don't have maybe enough family around or whatever. Maybe they need just a little extra help managing their medications. As you get elderly, sometimes you're like, oh, I forget which medication I'm taking, when I'm taking it. They can have a
So
home
with
health
the-
nurse come in and help them do that.
So with the home health, how are you going to incorporate that in your practice? Because it is a walk-in facility.
So I might be able to help out with that one. So the point is to keep patients out of urgent care and out of the hospital, right? And where we step in is the stuff that Dr. Kyle Peterson wants to accomplish, right? We do it at home. For patients that need a little more attention,
Okay.
they come into the office, they get seen, but medication management. As patients get older, memory starts to go a little bit.
Right.
Right? So our nurses can come in and reinforce what's being taught.
That's incredible.
So-
And that's even something that Jackie and I talked about on the last show that her and I did, where it is so crucial to know what you're taking, when you're taking it, how much you're taking. And I even brought up, I see in my grandparents, they have an organizer, but still they forget to take it and then they double dose and they're really being counteractive. So to know that you're partnered with Elite Home Health, it changes the game.
Right, that's an extension. I can't be in everybody's homes,
Absolutely.
but home health can.
Home
Yeah.
Health
And
can.
especially Elite Home Health, who has a great staff.
It's unbelievable.
So they're going to help me achieve that vision of education to the patients.
Especially coming into season in South Florida, and I never knew what season in South Florida meant
Snowbirds.
until now. It is crazy.
Well, and you also have flu season right now, too.
Oh yeah, Jackie and I were talking about that before, which is
So-
why it would have been so great to meet you guys about a month and a half ago. But it's okay. I'll keep
So
you in
yeah,
mind.
season with the geriatric population, the elderly population that comes down from up north for the cooler weather, the warmer weather. Although we've been a little bit colder lately, but also flu season where more people are getting sick.
So how are you going to deal with the people that come from up north or wherever they come from? Do you take people based on just the seasons that they're here, or do you really just look for somebody year round to stay?
Obviously, it's great to have somebody that's going to be year round, but obviously, if we can partner with their doctors back home and make a communication status, that would be beneficial for them because now they're
What?
not just dispersed to an urgent care or a hospital or whatever when they need something.
You just brought up something that I'm like speechless over, and I don't get speechless. You partner with
Yeah,
doctors back
we
home?
can reach back to their doctors and communicate. And I mean, that's communication is going to be the biggest thing.
Right.
Hey, who's your doctor back home? You're here for a couple months. Great. Let's keep you in health
Right.
while you're here. And then that way, when you go back home with your other doctor, you're able to make sure and manage your stuff there
That's
as well.
amazing. That's amazing
So-
because I even see a lot of doctors try to cancel each other out because they just want the patient all to themselves. But to know that it's really about the patient. And I know Elite Home Health is all about the patient and all about giving you the best care and communication.
100%.
Communication is everything and anything in life. And to know that you are incorporating this in your new practice,
That's what we want to strive for: is communication and education,
And that's
helping
why we
patients
picked
understand.
him.
Yeah.
That's why we picked him.
well, that's also the thing to know that he's with you guys. You guys don't just pick someone off the street, and I definitely don't talk to somebody off the street on WNN. I mean, it just goes to show, like, this is pretty cool. I
Right.
think maybe something will happen.
And I think it's a need that's out there too. I mean, that's
Yep.
the biggest thing. You see a lot of patients that, oh, I want to go see my primary, but I can't see him for 3 weeks.
Mm-hmm.
Or I don't know. You can ask people who your primary is. I don't know. Do you see somebody? Sometimes I go here or there.
Right.
You know.
And you know what? From my experiences, I had a primary health care doctor on Long Island. However, it was always a different doctor I was seeing. I didn't know if I was seeing the one that I was assigned to when I first went there and I saw her for the first 5 times or the one that I saw the last 5 times. I never knew who I was seeing. So it always provided me a little bit of discomfort just thinking, do they know everything that I was going through? Are they going to remember everything that I went through? Are they going to remember? Obviously, they have it written down, but
Right.
it's much more personal when you're meeting with somebody and you know and you're confident in who you're meeting with, especially as a doctor.
Right, and that's that family-centered care, that connection, that connections that we can make with our patients as a physician that really can help benefit the patient.
Right. Family practices, I think, are very important because you don't get to know just one, you get to know the whole family, and especially starting with somebody who's a teenager, you may be able to talk to their parents or their guardians and whoever just to really understand their medical backgrounds. I know I didn't know if my grandmother had cancer that passed away 3 years before I was born when I was 16 years old. So I think that's also so important. And obviously, family
home health.
practices are great, but just to know that you're incorporating that and to get to know everybody in the family aside from just the patient
Right.
and to educate and to help.
That's the biggest thing, I think, is education for the patient, for the public. Like you said, you don't know. That's not why your focus in life isn't necessarily 100% on your health. It's you don't know the ins and outs of the medications and the diet and the exercise and the lifestyle things that you could be doing to make it better.
Right.
And that's where we can kind of come in, and that's the training that we have.
Absolutely. And to know, obviously, that you're partnered with Home and Health, and this guy's taking over for Jackie. He's telling me that he's the
just
new
with Dr.
blood.
Peterson. This is my partner in crime right here. You
Now
know?
I'm selling him out.
Dr. Peterson.
Dr.
my bud.
Peterson.
So-
This is so incredible. So, Dr. Peterson, how long have you been in this practice?
So this primary care office is brand new. This is opening up now. Like I said, I've been doing hospital work, urgent care work before. I've been in the primary care setting with another provider once before.
Okay.
So I've got the experience, and I know where the
Right.
education is
You've
lacking.
seen all the
Right,
been
I've seen
in
all
the field.
Y-
all different
Especially-
fields of it, and and think this is where we can make the best change. Before, not when it's we're in the hospital, or not when I'm already sick or whatever. If we can make that change before.
That is so great. Especially going into the hospital and working in the hospital, I think that gives you enough exposure than a lot of other things, just because you see literally everything.
I can vouch.
Yeah.
I spent a lot of time in the hospitals greeting patients, and so many times they don't know why they're there.
Yeah.
Really, they're in the hospital, but it turns out it was something that's been going on for a couple months that
Right.
wasn't addressed.
Right.
And then on the other point he made, they don't know their doctor. Like they don't know their primary care
Right.
physician. Who do you see? I don't see anybody, and that makes kind of makes me sad. 'Cause
No,
when
absolutely.
they leave the hospital, it's where do they go? And
Right.
for us, it's nice to have doctors like Dr. Peterson to say, well, we have this awesome doctor that
Yeah,
you can
absolutely.
go see.
And it makes it even more sad because you know how much you value each patient, and you know that there's options out there, and you almost just want to coddle that person and just tell them, just let me come to your home. I got it.
Seriously.
But it's hard. It's hard, and a lot of people don't want to take the time. Time is the biggest thing ever for me in my life, and who am I? You know,
Right.
It's to know that I can call my primary health care doctor and see him potentially that day, if not that day, sometime that week.
Right.
So,
And I think that's the benefit. You know, we're becoming this generations and society of wanting things now.
Right.
You know, that's how fast can I get in? How fast can I see somebody? And that's, I think, where some of these older traditional practices are lacking is it takes weeks to see them.
And in health, that's of all the areas to
No,
have something
yeah.
instantaneous. I would say health's probably
With trying to be
the number
realistic
one.
with it. Right. You're trying to be realistic with, okay, I might not get this now, but I almost can't be realistic because I'm not going to have this stomach ache tomorrow.
Yeah, or it'll be worse, or you'll
Or
have
it'll
to
be
go to the
worse.
hospital rather than just go see your doctor.
And you know what? It's difficult because there are a lot of people out there that don't like to go see a doctor, period, regardless of anything. So when the wife or the husband or somebody finally pushes them to just go and see somebody, it's like, oh, well, you know what? I can't even see them for another week. Whatever.
Yeah,
I'll let it
right.
pass. And then you see some serious stuff happen, and it's hard to
Could have
witness.
been prevented.
Could have been prevented. That's
Could've
the
been
biggest
prevented.
thing.
Prevention.
Dr. Peterson, how can I reach you?
So we have our office phone number, 754-206-8250. And also like I said, we're going to take in some walk-ins, so you can always just drop on by at our office.
Where is your office
We are going to
located?
be at 3157 North University Drive.
3157 North University Drive in
3157. And that's going to be Davie.
Davie?
It's kind of on the edge of Davie, Hollywood, so it's kind of in that general area off of the University Drive.
Awesome. Awesome. When is the grand opening?
So like I said, we're going to be grand opening on the 19th, and then after that, we'll start seeing patients on a regular basis,
That's
Monday
so
through
great.
Friday.
The 19th, right before Christmas.
Well, we got to get in there sometime.
How are you feeling? Are you guys? What are your
That's the Christmas
hours?
present. You know?
Yeah,
So
right.
it's open.
He's
Come
gonna
see
cut the
us.
bow.
So that way, you make your New Year's resolutions, you can come in and see us, and that way we
Yeah.
can make sure everything
I
starts
like
on taken
that.
care of.
Yeah, right.
I like that. Make your New Year's resolutions
your
now.
doctor.
To see your doctor.
Right.
Go see your doctor. That should be my resolution. I am selling myself under the bus, but there are people like me out there.
There's
It's okay.
lots. There's a lot of them. There's a lot of them that, like you said, they don't want to go to see a doctor, or they just have an aversion for some reason, and that's what we're going to try and help foster a
It
different
comes
culture.
from, honestly, in my experience, it comes from fear.
Yeah.
How do you do with fear versus
Bad doctors.
Bad
I mean,
doctor.
my personal experience is when I don't go to a doctor that isn't listening, or that
Yeah.
doesn't, we're human. You can read body language. If you are talking to somebody that is supposed to be taking care of your health, and they don't seem like they care, why am I going to go back?
Right.
Why do I want to see that person
right?
again?
Absolutely. What do you
Or-
do to ensure comfort in your patients?
I think that's where the knowledge comes in.
Knowledge,
Fear.
right.
If you have a lack of knowledge, you're fearful of something, or if you're nervous about something, it's because you don't know.
Yep.
And if we can help understand what's going on, and you can understand what's going on with your body, or why you're feeling the way you're feeling, and how we can first help that, then I think that eliminates the fear. I think that eliminates the anxiety and the
Absolutely.
frustrations.
Absolutely. That's so great because, a lot of people do ignore going to the doctor because they're scared of what can happen. But after going to you numerous times and knowing that your whole family is with you, and even if you don't have family to go with you, to know that your trust is built into somebody that is really going to sit there and talk to you and tell you, not sugarcoat it, not say, oh, you'll be fine, just maybe see me in 2 weeks.
Yeah.
Maybe you might not want
But why are
to
you coming
ever
back
go
in
back
2
to work
weeks?
again.
Yeah.
Yeah, right?
You still don't know why you're going back.
It's like you might want to go to the hospital after this, but don't worry. No.
I think it'll be fine.
Everything will be fine. No, you're gonna give it to them straight up, and that's
Right.
the most important.
Eliminate
Educate,
that. Eliminate
educate,
that
communicate.
frustration.
Elite Home Health. Elite Home Health, Kyle Peterson. You have to know that you're with the best.
Yeah, that's why. And so, I mean, that's where the name come from. Kyle Care. I want this to be a little bit personalized. Kyle's my first name. Like most doctors, like call me Doctor So and So.
Oh my God,
Yeah,
it's like the
these
most
degrees.
insulting thing. I'm like, oh, hi, Frank, how are you? No, it's Dr. Peterson.
Yeah.
And I'm like, oh.
You can call me Dr. Kyle.
Sorry.
You can call me Dr. K, Dr. Peterson, whatever.
Yeah.
I don't care. Like it's not what I live and die by. But
Great.
what I really want to make sure is that people feel good, people are taken care of, and that they're healthy.
Absolutely.
And that's where it comes from.
One last question.
Yeah.
Now, when you see somebody that you might have a little bit of concern of if they're taking their medications, how they're taking it, and of course, Elite Home Health covers that, do you contact them right away? Do you send them a list of patients that they should maybe follow up on? Are the patients coming into your office aware that they have the option to deal with people from Elite Home Health?
Right. So if as we're talking to our patients and we assess, and we're not just, like we said, not just, okay, you're here for this, okay, bye, you're out. You know, we're going to understand, well, okay, what do you have at home? What are your needs?
Right.
Can I have somebody come in and help you from Elite Home Health? And then once that partnership has been made and the patient says, yeah, I want to have somebody come in and help me, now there's communication not only between me and the patient, but me and the home health care company, Elite
Right.
Health.
And
We
we-
talk on daily, weekly
daily,
basis
daily.
about
Actually,
almost all the
daily.
patients that we're seeing and things are going on with, and where that extra help can come from and how we can help them.
That's incredible. Just seeing somebody, because what we were talking about even the last show with Elite Home Health was you don't know everything when you're in the doctor's office. But if people are open to, you know, and you can have the communication open with people that are going to go and help within the household, you're combining everything that you need to ensure a healthy lifestyle.
And
Right.
we're a Medicare certified company, so the majority of our patients are a little bit older. So those conversations are a little more tiered to as these patients are getting older, as these issues, as their health is deteriorating. When can we step in? When can we
Right.
keep you living your best life?
Right.
And how can we help enable that?
Especially for those who are older, because it's for anybody, it's good to have a helping hand. But a lot of people are living alone when they're older, and you know, it's a little bit upsetting to ask for help. But when you're sitting there, you're offering, you're saying, you know what, I want to be there. It's not. It's not even like I'm considering it my job. I'm considering it something that I want to do to ensure your healthiness and to. Of course, you probably want to see your patients all the time, but you're going to have enough patients
If
to
I could be in
keep you
everybody's
busy.
plate, everybody's home every 24 hours, I mean, I could be everywhere at one time, it'd be fine, but that doesn't work. So,
All my confidence is in you. I will be at your office whenever it opens. The grand opening December 19th
December 19th
in Davie.
in Davie.
3171?
3157.
3157 North University Drive
Yes,
in Davie.
Davie.
Thank you so much. And thank you so much for supporting Elite Home Health. Obviously, we as a team,
It's a teamwork. It's a
excuse
team.
me, we as a team appreciate you. No, but seriously, everybody that, even if you do have a primary care doctor, come on down to Kyle Peterson. You could call him by your first name, and that's how you know
Dr.
that
Kyle.
he really is your friend and your
Yes.
doctor and your protector.
We'll be there as part of your family.
Your family.
Family
All right.
approach.
Give me your number one more time.
754-254-82. Oh, sorry, no. 754-206-8250. That's
Awesome.
our office phone number.
Awesome. You know what? One more question.
Yeah.
Jackie, what was that? Hospital affiliations.
So I've got quite a couple of them. Broward Health obviously has been one that I've been with the most and the longest. That's Broward General or Broward Health Medical Center in Fort Lauderdale. But also we're working with Memorial Health
Cool.
as well, which is close by to our office. So.
Wonderful. I look forward to seeing where it's going to bring you. And I hope to have you back on the show to see your progress after December
Come by
19th.
the office. We'll take
Oh,
care
I'll
of
be
you.
by the office because now I sold myself under and everything. I am done. Well, thank you guys for tuning in. Tune in every other Monday at 7 to 8, where Elite Home Health brings in the best of the best professionals for your health care. Good night, everybody. Thank you for tuning in. My name is Jackie Birch.
Thank you for listening to the Elite Home Healthcare Show. Elite Home Healthcare delivers care to you or your loved one in the familiar comfort of your own home. Medicare pays 100% of the costs with no copayment and no deductible for qualified homebound patients. Elite Home Health Services will develop an individualized plan of care to meet your specific needs. Skilled registered nurses and physical therapists will plan and implement your care, along with your participation and your doctor's guidance, assuring a plan specific to your needs. We'll make multiple visits to your home over weeks or months to make sure you are recovering according to plan. For more information, call us 888-422-3578. Join us for more information and news on our next show.
Premature birth is the #1 killer of babies, but you can do something